Well, folks, thanks for joining us again for our weekly Texas Public Policy Foundation live stream primer. If we've not met, I'm Kevin Roberts, Executive Director of the Foundation, based here in Austin, where it is a privilege to be. Downtown Austin is not quite bustling, but boy, with each passing week, really each passing day, it gets busier and busier. I think proving the point that regardless of whatever the mayor says, we can trust individuals to exercise their rational self-interest, which I always like to remind people is not something that's going to contradict the common good. In fact, they go hand in hand. And so rather than have one of our policy experts on, which has been our custom the last few weeks, this week we're in for a treat. Not that we don't have a treat when we have our policy experts on, but this week we have some business leaders from Texas who are going to help us understand this situation from the ground, from their perspective. And I'll introduce them momentarily. But I think what you can expect from us in this conversation is a heavy dose of reality. Each of us is very cheerful and we're cautiously optimistic that because this is Texas and America, that we're going to see this crisis through. But I know, speaking for our guests, Dennis Nixon and Victor Leal, that each of us is worried that the longer this shutdown goes, the harder it will be for us to recover economically, and I might even add socially, let alone what's going to happen in terms of policy for the next legislative session. So we're in for a treat. We have in Dennis Nixon, not just the CEO of IBC Bank based in Laredo, a bank that of course has a few hundred branches across the region, a fellow Longhorn, a fellow member of the governor's special advisory council to the strike force to reopen Texas, someone who's been a real leader in business and policy thinking around Texas. Joining us is Victor Leal, a good friend, former TPPF board member, who's a restaurateur in Amarillo and Muleshoe, where he served as mayor. He too, a native of South Texas, Mercedes. And so it is a pleasure, gentlemen, for both of you to join us. And I'll be asking a series of questions for the first half of our conversation today. Of course, you know, you can feel free to take your responses wherever the truth leads you. And then when we get to the second half of our conversation, I'll invite the audience to ask us some questions in the comments box, and I'll field those to you. And I'm sure that we will have a good time. So thanks for taking some time and joining us. Dennis Nixon, the first question for you is sort of a general question, given your business experience in Texas over the last few decades, particularly given your experience in the banking industry. What are your 30,000 foot thoughts? In other words, before we delve into some of the details, I think a lot of our audience members, given your experience, are interested in hearing your perspective about what's going on around us.
Well, in terms of where we are today, my 30,000 foot view, now looking back on the events that occurred, is that we've drifted into areas now that are really becoming a great concern, I think, to people who follow economics, especially that we may be passing a tipping point and that we haven't reacted quickly enough to get the economy back open and get people back to work. When you're looking at potential 20+% unemployment, or numbers that I would have never expected in my lifetime to even think about. And the more worrisome number two for me is the fact that some of the large modeling companies that are Moody's and people like that are predicting we could have as much as a 30% drop in the GDP by the end of the next quarter. Those kind of numbers are frightening, really frightening. And especially when you look at the details of the coronavirus and what the impact of that has been and the decisions that government made, when you put those two together, I feel like there's been a colossal error made in shutting down this economy like it's been done.
Well, thanks, Dennis, for that. We'll come back to that comment about the government's role in the shutdown. I want to bring Victor into the conversation here. Victor, obviously, you as a restaurant owner, someone who also serves on the Lieutenant Governor's task force to reopen Texas, have some thoughts about this from a 30,000 foot view. Before we delve into some of the details of your perspective regarding your industry and your business, what are your own general thoughts as a leader of this state regarding what's going on around us?
I echo what my colleague Dennis says. I think the longer this goes on, the tougher it becomes, because in Texas, we've about 700,000 jobs lost in the state of Texas already in the restaurant hospitality industry. Kevin, so that's devastating, being on the front lines of that. And like I said, right now, one of the biggest problems that we have is perception of safety. And then trying to get folks to come back to work have been really difficult. So we feel like the longer this goes on, the more devastating it's going to become. Some of the numbers that we're looking at right now is we could see as many as 30% of the restaurants across Texas falter, completely close down if we don't bring this to some sort of resolution quicker rather than later.
Well, thanks. I want to come back to a couple of those problems unique to the restaurant industry on the employment side, but also the occupancy cap, Victor. But before we do that, I want to get just a little more detailed with Dennis, particularly given your leadership in the banking industry. From your lens, Dennis, as a bank CEO with branches all over the state and region, what are you hearing from customers or from people in the communities where you have branches? What are their thoughts about the economic shutdown, about the government's role in shutting us down?
I think people really haven't come to the full reality of that action. I think it's more almost like a given that we needed to do this, and that nobody is really fighting back that much against it. Now we're starting to see business people, certainly people like Victor and others, that are starting to say, "Wow, this is just beyond the pale now." And we've been spending most of our time dealing with individual loan requests and individual forbearance and deferral requests. I mean, they're just people parading in the bank every single day by not a few, by dozens and dozens and dozens in all of the markets we're in. We're in 12 regional markets, and we're just being overwhelmed with requests to defer payments and to put things on hold in order that they can try to sustain themselves through this problem period, and only paying the absolute essential things that they have to pay. We also were involved in the PPP program, the SBA PPP program. We put together over 4,600 loans in just a few weeks to deal with that. So that was a massive undertaking of our team. Fundamentally, we've been working 7 days a week, and in one period we were working all night trying to get these loans processed because of the fact that the system was slow, and we just needed to stay with it to get it done. So I just feel like a lot of people out there are starting to get on beyond edge. I guess they're getting frustrated by the fact that the process is too slow. We're picking winners and losers again. The government's always done that. I've been very disturbed about that we've allowed certain businesses to be open, and they're right next door to a Walmart. There's a small retailer there selling something, and they're not allowed to be open, which makes no sense to me. People are actively involved in large operations in H-E-B and Lowe's and Target and Walmarts of the world, Home Depot, and yet we've got all these small businesses shut down. I think this is clearly an attack on small business. I think we could lose, of 30 million plus small businesses in America, I think we could lose 3 or 4 or 5 million of them, because they're just not going to have the resources to open up again, because this delay has been extended and extended.
I want to follow up on a couple of those themes, Dennis, but sort of keep this conversation thread going with you, Victor. Take those comments Dennis has made about what they've seen in their banks around the area, and have you comment on the restaurant industry generally, but perhaps even what you've experienced with your business, whether it be difficulty in getting employees to come back to work, or what you're hearing in your restaurants or around town while you're in Muleshoe or Amarillo.
Sure. Apparently, Dennis and I were separated at birth. We never met, but what he's saying, I echo 100%, 1,000%, because he's exactly right. Yesterday, a good example, my restaurant here in Muleshoe, we closed for Mother's Day. We've been closing on Sundays, but I went to the local grocery store. There's no social distancing going on. There are at least 150 or 200 folks. A lot of good friends of mine that I haven't seen in a long time. So we were talking, not being responsible. So, and then you go across the street, and the authorities, the powers that be, are saying, well, you can only have 25% occupancy right across the street with the very same folks. So it makes very little of any sense at all. I understand the precautions, fully understand early on. And the way I understand them is we're trying to make sure that we didn't overwhelm the healthcare system. We didn't overwhelm the healthcare system. And in fact, the healthcare system right now is suffering because they don't have enough patients. They did away with selective surgeries and things of that nature. So specific to the restaurant business, just for your information, we closed Amarillo completely. We're not doing curbside in Amarillo. We're not doing the full service dining, because we can't operate with the constraints that we have at 25% occupancy. For us, it's just a slow bleed. So we'd much rather just close down there. Muleshoe is operating in a much better clip. We have people that are anxious to come back to work. We've been able to get our staff mostly back. So I think it just depends on where you're at. There's a perception in Amarillo because there was a spike due to the meatpacking plants there of the COVID cases. So there's more of a fear or concern to go back, to restaurants. So we're suffering from that, from the perception of that. In Muleshoe, I think that people are just ready to get back and to some sort of normalcy. So I think it depends a little bit of where you're at.
Sure, I think that makes sense. I'll come back to you, Victor, on some of those restaurant-specific questions. But curious, Dennis, and of course, you're not an alarmist. Victor is not an alarmist. The Texas Public Policy Foundation doesn't participate in that. But I've had a lot of friends of TPPF ask the question over the last couple of weeks: has this shutdown and its economic consequences reached the point that we need to be worried about banks? Obviously not asking you a specific question about IBC, which I know is very healthy, but about the banking industry generally, or because I know it's in your heart to help people who come in who want to pay their bills and have a history of doing so. But are you beginning to grow concerned, or have you seen some concern among some industry leaders in banking?
Well, it really hasn't jumped to the forefront at this point because this crisis has taken effect during a period of time in which the industry had completely recovered from the 2008 period, 9 period, and capital was massively improved in the industry. I mean, our company's got 3 times almost as much capital as the regulatory requirements. So there's a lot of banks that have built their capital, built their quality and their balance sheet. So I think that's not an issue today, but when is today going to turn into tomorrow and be a big problem for everybody? And that's why keeping the economy closed, there's just so much time that people can spend doing nothing, and you start to get from the fat to the to the muscle to the bone. And so if you get into the bone, there are just a lot of different scenarios that play out that are different than we have today. I mean, obviously, if half of my customers cannot succeed, then half of the customers in my company, I have a banking issue. And so the same thing would go on everywhere. We've got issues. If Victor can't get back to business, he's got a problem. And we've got people have to eat, people have to support themselves. How do you handle that? And so that's why I say we're getting to a tipping point when you're looking at statistics of 20 and 25% unemployment and 25 or 30% drop in GDP. I mean, we've already seen what's happened in the oil industry. I mean, basically been just completely collapsed with demand down 50%, all drilling basically stopped. All those people working are out of business. When is that going to come back? It's not going to come back until oil prices move up. And so when is that going to happen? People got to get back on the road. People got to be going to restaurants. People got to be out shopping. So this whole process of turning the corner is not a small thing. And so I just feel like that the political people, who in many cases are not business people, they don't understand it. Just like Victor talked about, somebody's saying open up 25%. It's not about the number of tables you have in your restaurant, it's the amount of times you turn those tables. You have fixed overhead. Many restaurants cannot open with those kind of small numbers. And then you've got a problem already in which people are reluctant to come back anyway. So by putting a limitation that's basically, I don't know who came up with 25%. Why does 25% work that 35% doesn't work or 45% doesn't work? They pull these numbers out of the air, and they're not thoughtful, and they're not based upon what the retail industry is designed to do. So it's very frustrating to me, and I'm sure Victor is probably pulling his hair out over this, but that's the problem, is that people who don't know the business, setting standards for the business that can't be met, and it delays the problem and pushes it out further and further. And it creates greater pain, because if it does open up and it starts losing a lot of money on operations, then they are closing the door on their potential to succeed again. So it's a tough call. I mean, I'm having to listen to people every day saying, should I close the business down? Should I partially open it? Should I do curbside? Hotel operators are saying, I've got a little business. Is that a better choice than to close it down entirely? And so everybody every day is making these nuanced decisions that are very critical to their survival. And I can guarantee you that those kind of decisions can't last forever. There's just an end. There's a tipping point in which businesses after business after business will just fail. They will not be able to sustain themselves.
And I wish, Dennis, as I'm sure you do, that for those people out there who don't understand why we're trying to reopen, in fact, or even critical of Texas reopening partially, that we could somehow give them a crystal ball to let them see later in the summer the full effects of staying shut down so long. And it isn't just that a closed business obviously affects the business owner and the employees of that establishment. It affects entire communities. It affects how Americans and Texans go about their lives. So that's something that over the last couple of weeks at the foundation, we've been trying to elevate and telling the story of these business owners around Texas, because like you, I believe firmly that the longer this goes, and I'm thinking weeks, not months, that we're going to start getting to bone, and that's really where it's going to hurt, and it's going to hurt permanently because of how we've come to expect certain things materially, especially in Texas. So I want to pivot back to you, Victor, and talk about the restaurant business. I want to mention something to you that another restaurant leader mentioned to me last week, and that is this complaint, as Dennis articulated well, about the 25% occupancy cap. He said they can't even move to 50% occupancy, provided that there's still this 6-foot social distance. There isn't even the square footage. Can you address that?
Absolutely. And just a couple of comments quickly before I do address that question, Kevin, is Dennis may not be aware, I was on the Texas Finance Commission appointed by Governor Perry a few years ago. And so I know well the reputation of his banks. And but we used to have a saying that it was too big to fail, but there's also too small to succeed because of regulatory issues. And so that's what's going on. My concern, and it segues into the question that you have, the small restaurant owners, the longer we go on, there's, the big guys have a lot of money. They have a lot of, and my concern is there's going to be a Darwinism the longer we go on, that there's folks that are the small business owners like us are going to eventually have to make those decisions, permanent decisions. And so that's going to be really tough on a lot of families, on a lot of employees because of that. But to your question on occupancy, listen, there is anyone on the face of the earth more concerned about my staff than me. There's no one on the face of the earth more concerned about my guest than I am. I've been serving in Muleshoe, Texas, where I am today with my mom, my 88-year-old mother, who started our business in 1957. I face these folks day in and day out, Kevin. Do you think that Miss Ruby Green, who's 101 years old, I'm not concerned about her safety or everyone else's safety? So when the governor or anyone, when the officials say you can only open, Victor, at 25%, I can't operate efficiently at that. Where my position is, let us decide, the restaurant owners who are well-versed in safety. We're the ones that go through all the Serve Safe and all the sort of training. We know safety issues. And so let us be the responsible folks. I believe there's a stratus that we should, if you look at the statistics, there are several folks that are more prone to this disease and it being, very, very bad for them. It's the elderly, folks with diabetes. And so if we say, if you have those conditions, don't come to work. And if you have those conditions, let us take care of you with takeout or curbside. But otherwise, our industry is staffed with a bunch of young folks who are healthy, and the statistics just don't show that they're at risk. So, yeah, let us operate, let us open up, let us be responsible, let us do what we do best, take care of our guests and take care of our staff at an occupancy that we decide, not somebody away from it.
And I know that you've elevated that point to the task force, the lieutenant governor. Dennis and I have heard that as well in the roles that we have with the governor's strike force. And Dennis, I want to come back to you and introduce yet another challenge, another dynamic, which is that as the state government, in particular, Governor Abbott, has moved to reopen Texas partially, we've started rather predictably to get a lot of criticism and even pushback from local leaders. The mayor of Austin, the county judge of Travis County, Harris County judge. You've seen it in San Antonio, as I discussed with one of your colleagues. And I'm curious what you think the solution to that is. Is it that Texans need to clamor for this reopening to pick up the pace? Is there some other solution to that experience of local officials trying to stand in the way of what we see as progress in reopening?
Well, one of the things that we asked the governor to do in the strike force, and I'm not here speaking for the strike force, I'm speaking for myself, but was to override these various city ordinances and make a statewide process, because we had too many cities that were doing crazy things. I mean, we operate 88 cities, and every one of them had their own plan, and everyone had their own idea about how they were going to enforce this based on nothing real. And I guess what really frustrates me more about anything about this is I understand the sequence of events when this thing first started appearing, and we had these crazy models, and they were extreme, and everybody quickly understood they were extreme. But we started getting real data, and I did some work myself, and in my paper that I presented to the governor, and I believe I've shared with you as well, I went through the process myself. This wasn't difficult. And I focused in on a data point that I thought was really critical early on, which I found a report that said the average age of the person dying was 73. And we had a clear indication of that data point when the nursing home in Seattle, Washington had all those deaths. And that was, to me, a defining moment where we should have hit the pause button and started looking at the real data and the real issue here. And who is affected by this disease and this virus, and who are the people at risk? And so we've never quarantined all the people in the country ever in our lifetime, healthy people. We've quarantined people who are sick and who are exposed to danger. And so we've got this thing backwards. And all this data that they're looking at about the increases in the number of cases and all that stuff every day, that's not relevant. What's relevant is, what are the number of cases in the at-risk people? And I pulled up San Antonio's numbers here just a few days ago and looked at them, because I looked at Laredo and presented that in my paper since I live in Laredo, but I've got big operations in San Antonio. They've had 54 deaths in San Antonio. 78% of the people that have died have been over 60, and every one of them had an underlying health condition. They had another 7 in the 50 to 59 category that were all underlying health conditions. So if you take the two totals, 90% of the deaths have been in people that have underlying health conditions and who've been old. There were 5 cases below 50, and 4 of those cases were underlying health conditions. So fundamentally, I would argue that we shut down San Antonio, Texas for one person. We can control and identify who these people are. I pointed out in my comments to the governor that there's 3.6 million elderly people in Texas. And we know where they are. They're in nursing homes, they're in old age facilities, they're in retirement facilities, they're in over 55 communities. We know where they are. That's where we should be testing. That's where we should be managing this problem. Whether my 25-year-old grandson gets ill or not get ill, or whether there's not one single person in San Antonio under the age of 30 years old that's died. And so we've got the entire state, the whole country shut down on a false premise. And I believe we went completely off the farm when we didn't stop and hit the pause button and say, where is the risk? That's one of the things I do in my business. I manage risk. And so when I'm looking at a problem, I don't look at the ocean. I try to get down to the drop. Okay, where is the problem here? Where are we having the difficulties? And that's what we should have done. I pulled this data up on several cities. It's all the same. It's all the same. And yet we still want to shut down the entire community. We are not going to have a lot of people die. And when we quarantine people, we're breaking down their immune system. You know, one of the doctors that I talked to said the whole process of immunity development and retention is social interaction, social engagement. We're constantly reinforcing and building our immunity. And so when we quarantine the healthy population, we're in effect really damaging that. And so we're going the wrong way in so many different ways here. And it's become now a political issue. So anytime anybody comes out and says, open up, we got all these 24/7 guys screaming about that one person who's died and this person's died. I think when we look back on this, this is not going to be any more serious than the regular flu season. And it's regular flu does the same thing. It attacks old people, attacks people with underlying health conditions. And so I think this has been a colossal error, cost the country probably $10, $15 trillion. We're going to have an enormous disruption of so many lives. And when people say the economics don't matter, I beg to differ with you about that. Is it people, I'm seeing people who multi-generations are losing their businesses. They've worked for 70, 60, Victor's business alone, talking about 60 years of being in business. For him to lose that business is not going to be a traumatic effect to him and his family. And how many family members are probably involved in his business that he supports and helps and creates value for our life. So these people who want to just talk about the health side of this without the economic side of this, I think are really missing the boat. And I think we're going to have damage to this country that will be possible to fix.
It's really, really well said, Dennis. And I appreciate your thorough analysis. spoken here, but also in the paper that you shared with me. And I think that Dr. Donna Campbell, who serves in the state Senate, said it well on this event a couple of weeks ago, which is that we don't quarantine healthy people. That's just not something that we do. You quarantine people who are at risk. And I think with each passing week, we're understanding that in Florida, where the state government moved much more aggressively than in other states to identify those at risk, namely the elderly, that they've had a lot of success in mitigating the effects of this virus, much along the lines of how we have in Texas.
Well, what's scary, Kevin, is the fact that they're talking about, if the numbers go up, they're going to shut the state down again. Well, the numbers are going to go up. You've quarantined all these people and you put them back into society, and even in this so-called, this terrible 6 feet social distancing baloney that they propose, that's going to create some issues where people are going to get sick. And so that's not the problem. The problem is the people that are going to get sick are the people that we know, they're the elderly. And those people are smart enough to understand that they need to stay in place to protect themselves. Where we should have been out there saving lives is in these nursing homes. We have 1,200 nursing homes in Texas. What has been the approach of government to deal with nursing homes, and how we focused on testing those people and separating those people, because those people are at risk. A 29-year-old person that's perfectly healthy, 1 in a million that person is going to die.
Yeah, that's exactly right. And Victor, I'm gonna get you looped into this conversation thread momentarily. I just remind people that in Texas, we spend a lot of time outside fishing, hunting. In Austin, a very active city, as most of our cities are, with people cycling and running and hiking. And I think that's been one of the secrets to making sure that the virus has not been the health threat that it was in New York, for example. We spend time outside. We also can think for ourselves. I think that's a really important thing to remember. So Victor, just want to bring you into that conversation. You may have some observations that are Amarillo specific, but I know you've got some general thoughts based on your experience with the Lieutenant Governor's task force as well.
Listen, Kevin, you and I, Dennis, we champion liberty. We champion freedom. We champion the thought that folks are wise enough to make decisions for themselves. I went on a ride on my Harley. I have a beautiful 2018 Street Glide Harley, and rode a few hundred miles the last couple of days. Listen, I wear a helmet when I ride my motorcycle. I wear a jacket. I have gloves on. I have boots. I never drink a beer when I'm going to go ride my motorcycle. There's an inherent risk in riding a motorcycle, but I mitigate and manage that risk. And I go out and ride and I have a great time. It doesn't mean I'm never going to get hurt, but I'm willing to take that risk. So I think really the big question that we have right now at this tipping point is, what kind of risk are we willing to live with? What kind of risk are we willing to choose as freedom-loving Texans and Americans? And I believe that for the majority of folks that can think for themselves and are saying, listen, I have a business, I'm going to do the best I can, to have safety precautions in place. But life is a risk. Last time I checked, we're all, nobody gets out alive. So we're going to mitigate those risks. We're going to do the very best we can. But when do we ever let someone else choose for us what risk we're going to decide, whether it's in business, whether it's in our lives? And I'm not talking about taking crazy risks, but Dennis hit the nail on the head. The fact of the matter is the death rate on this is mostly skewed towards the elderly. So yes, take care. I mean, I'm taking every precaution when I'm around my mom, who's 88 years old, but geez, we have a workforce and, in the state of Texas, that's healthy, that's vibrant, that's ready to get back at it. Let's let those folks go to work. Let's let us get to work and get back to our lives. And of course, there's going to be risks with that, but we choose to mitigate those risks and live with them. And you're never going to eliminate every risk. So it's part of being free, is having to deal with risk.
Yeah, your comment reminds me of a comment that one of the Midwestern governors made. I imagine this governor was probably right of center based on the comment. And that governor said, look, we can eliminate all traffic deaths or almost all traffic deaths by lowering the speed limit to 5 miles an hour. And, other than those of us who'd have a heart attack for having to drive so slow, being stuck behind someone driving that slow, there wouldn't be any traffic deaths. But we, to your point, Victor, and what you were saying, Dennis, all the time as a free people, and just our own minds, we don't have to have any government entity tell us what to do. We make those assessments. And I think that's not only what's been missing in this entire pandemic response, but it's also something that is possible, can become permanent, which is sort of creating an enlarged number of people who are dependent on government. And that's what scares the daylights out of me, that we're even seeing that in Texas. So I want to pivot here before we, in a few moments, pivot to audience questions, which we're starting to get some of. And that is a pivot toward looking ahead. And as I promised at the beginning, for those of you who've joined us as guests, we're going to be candid. Sometimes candor is really pretty and sometimes candor is really ugly. And there's some candor about this that's not very pretty. But I just want to see if we have any reason for optimism. Let's say in the next few weeks, more and more of Texas reopens, either because of something the state government says or because we as individuals exercise our freedom, to your point. How quickly, Dennis, can we expect the economy to recover in Texas?
Well, that's a $64 question right there, Kevin. I think if you get government out of the way and you start letting businesses operate and make those choices and let everybody else make their own choices, I think the return is quicker. But if we continue to try to wade into this problem solution by step at a time with these crazy numbers that they picked, I just don't know what that outlook would be. We're going to have a rise in cases. We're going to have more fear being produced in the 24-hour news cycle, social media issues. We're going to be criticized. We're going to be damned. The political process is one that responds to that kind of criticism. And so whether they back down and don't move as quickly, it's all depends on that. I mean, when are the airlines going to get occupancy again? When are the hotels going to get occupancy again? When are people going to actually want to, get out and take on these new activities? It's hard. And then when you have 20 or 30% unemployment, I mean, when are these people going to get off these government support programs and actually go back to work? That's going to be another question. So there's a lot of answers that questions that we're looking for answers on. And I can't say that I can say with any certainty. I would hope that if we get completely open again and we start moving again, that we'll start to see some good results by the end of this year. I think this next quarter is obviously a doomed quarter, but I do think the third quarter and the fourth quarter could show some positive results. And then if people, let's say we get a vaccine, although probably half the population wouldn't even take the vaccine like we have with the flu, but the psychological benefit of that and the political cover that the vaccine gives could pop us back up into a quick activity again very, very fast. So those kind of unknowns out there really are what are critical to the decision making about what we do. And government, I went through the 2008 crisis, and I can tell you, we came out of the 2008 crisis and we lost over 2,000 community banks. Yeah. And I think we're going to have the same kind of experience here in a much shorter time frame. I think we're going to lose several million small businesses, and those people hire people. Those people are the innovators. Those are the people that really create the great strength of this country. They are the DNA. They are the mental value of this country. Those are the people that really work hard. And if we lose 10% or 12% of our small businesses, that's a big road back too.
I'm particularly worried about community banks being a big fan because of what happened with the Paycheck Protection Program. You talked about IBC stepping in, working not just 7 days a week, but I'm sure that first weekend the applications opened was that weekend. Your staff were working around the clock, processing 4,600 applications. And then you contrast that with a lot of the news stories about the really big international banks being so slow-footed to respond to that. And I think a lot of people don't realize banks like yours really are the heart and soul of America and Texas, just like restaurants like Victor. So Victor, take this question to you and ask you, should we forget the thought of a V-shaped recovery at this point?
It's hard. It's like Dennis said, it's very hard to predict 6 months or even a year out. I think there's going to be further pain. But let me tell you, I am very optimistic about the future of the state of Texas and the United States. Let me tell you why. I believe that I've seen in my own communities innovation that is just incredible. Folks, when our backs are up against the wall, in every business, we find ways to adapt and to adjust and to serve our guests, serve our customers, serve our patients. But let me tell you another thing. There's going to be a repatriation, I hope, of the things that we've been making in China. I think that we have sound government policy with low taxes and light regulation. I think we can bring those companies back to Texas in particular. And I think we can start doing manufacturing production if we do go about this right. I think, to be honest with you, I think that that this is one of the greatest opportunities that we're going to have in terms of innovation, in terms of bringing back companies to the state of Texas. Think about this. You and I are educators, home educators. Think about the public schools now, that they're going to be able to maybe look at options instead of every kid having to be in class every day. They can look at now hybrids of, hey, why do we have to do that? Why can't we do things more online? You're sitting in Austin. I'm in Mule Street, Texas. Dennis is in Laredo. We're having a meeting right now with your listeners on Zoom. You talk about innovation. We thought we were going to have a lot of issues with transportation. We're going to learn to do things more, from home or from different areas. I think, it might take 6 months or a year to start seeing real recovery, but I'm very optimistic that in 18 months to 2 years, we're going to see a boom if we're ready for it. Again, there are going to be a lot of things that we have to take care of on a policy standpoint. And that's why the Texas Public Policy Foundation is so important at this time and others, because we need to guide those policymakers towards sound policy that pave the road for a great, recovery. But in my mind, it's going to be there because there again, we're freedom lovers, we're Texans, and we innovate. And after this is, after the threat of this is passed, or the fear, I think we're going to see a tremendous boom on the other side of this.
Yeah, I share your optimism. It may take a few months, to Dennis's point about the end of the year, to see the momentum of that growing. I'm more optimistic, of course, about Texas for many reasons than I am other parts of the state. And I would say, based on what I've seen, that while probably for most of us on this conversation, guests and the two of you, we'd like to see the pace accelerated. I'm grateful that we have the pace that we have in contrast to some other states. And so I think it's incumbent on us who've got some opportunities to pass along ideas, to very consistently say, just speaking for ourselves, our own businesses or organizations, this is what we're seeing, and basically Texans are ready to live again. Let's get government out of the way, other than playing a very important role in identifying, isolating those at risk to this disease. I'll pass along one thought, and then we'll pivot to some audience questions. My neighbor in the Hill Country in Texas has a niche real estate business of selling ranches and rural properties. And for the first 5 weeks of this economic shutdown, he was really struggling. He was worried about the future. And when I spoke to him early last week, things had changed on a dime. He said it was more than a V-shaped recovery. It was like an L-shaped recovery going straight up, because to your point, Victor, people realize I can telecommute. I don't have to drive into Austin or San Antonio. I can even think more creatively about where my kids go to school. And I'm not going to wait for the school system, which for whatever reason might be too slow in responding to innovation. I'm just going to do that on my own. And so he's selling a bunch of rural real estate again. I think we're going to see that. And of course, in that new trend are some opportunities. So we're going to switch to some audience questions, and I'll read the first and maybe pitch this one to you, Dennis, and then come back to you, Victor, if you've got some thoughts. And this questioner asks, Austin businesses, and for that matter, some other city businesses in other cities, are asked to log patrons for tracing purposes. This questioner says, I take issue with this. Is this legal? The city of Austin is closing down parks when they think the park is at capacity. Is that legal? Dennis, what are your thoughts about that level of local control?
Well, I don't know if it's legal or not. Obviously, it's offensive. And that's one of the things that we've talked about here. Is I think that government is speaking on new roles here that I couldn't even imagine was even possible. I said, what in the world did the power come for these people to be that prescriptive on everything we do and talk about every day? And I said, when you really look at where the risk is in our society, with this virus, it's not in the average person out on the street every day. It's in those nursing homes at these old age facilities. And so, the 98-year-old person at risk is probably not out in the park. And so it's really shameful to me that they have not looked at the real data. And it's almost like opportunity to put more of their values and their ideas into your life instead of letting the people make their own choices. So I'm extraordinarily offensive. I know there's been a couple of lawsuits filed, challenging the governor's authority to do any of the things he's done. This whole process, I guess, will work through the rat through the hose here at some point down the road. But it's really disturbing that a city mayor, for instance, could shut down the whole city on the premise of some kind of threat that I could go from city to city in this state. I bet, and every single city will have the same kind of numbers as Laredo has, as San Antonio has, as the state has. Even New York, their numbers are basically still in the same zone as the numbers I've quoted from San Antonio. And with all the hysteria New York has, New York City is 8.5 million people. You'd expect a lot of issues there, but they've gone crazy with it. And government's done that every time we have a crisis. I mean, I do think government does not waste a crisis. They take more power and they intrude more into our lives. We saw that in the banking business in the 2008 period. They passed the Dodd-Frank legislation that basically put a very prescriptive process in place and basically systematically has killed most of the community banks in the country. So yeah, government does take advantage. They won't waste the crisis, and they will take advantage of that situation to impose their will on society.
Yeah, on the back end of this, I know when we say things like this, our friends who are left of center are disoriented because they think that if someone describes themselves as free market or conservative or right of center, that we think that all consolidation of capital is good. In fact, we think it's kind of bad. I mean, the trend over the last 15 years, and Dennis, you know this, I know Victor knows this well, toward consolidation of capital in the banking industry is not good for the average American. It's not good for the average community. And I think that this crisis will only accelerate that. So Victor, I just want to stick with this local thread. I'm curious what you've seen in Amarillo. Have there been similar overly orders from the mayor or county judge?
Yeah, I mean, listen, I'm an advocate. I was on the task force. I advocated for a uniformity because there are several restaurants, chains that operate in so many cities. So I thought it made a lot of sense for us to ask the governor if he made an order that it was, that it would supersede local control or local authorities, and that it was a good thing. However, I warned my fellow task force members that as a person who's always championed subsidiarity and local control, if we had the wrong person as a governor, it'd be something that we'd be against. And so it's put us really in this tricky dilemma, Kevin. If you think about it, you and I have always been champions for local control. And so I'm still an advocate for, this tricky situation. I like the fact that we want to be close to those who govern us. And so to your point, I think that in a lot of issues and even beyond this, I think our local officials have been too controlling, and it's shown up and it's bitten us in a lot of permitting, for instance, and that's been a long issue in Amarillo where the permitting process takes forever. I've been a victim of that, so to speak, trying to open up a new location. So we want to make sure. I think what it comes down to is this: whether it's in Austin, Amarillo, Temple, Laredo, wherever you're at, I think this is a wake-up call to folks to make sure that they're active and engaged in local elections, that we make sure that someone like a mayor in Austin can't take this kind of authority. I think it's going to turn off a lot of folks, and not just conservatives, or folks that are more libertarian, but I think it's going to turn off a lot of folks, and hopefully they'll get engaged. What we don't want is government overreach, and I think hopefully this will wake folks up. But still a champion of local control because I think it still makes the most sense. But I want to make sure that in some of these issues that we're championing uniformity. So it's a contradiction. It's a paradox, like Chesterton says, and we want to make sure that we don't throw the baby out with the bathwater. We want to be very careful that the control doesn't stem from Austin on all these things. So that's just like I said, those are some of my concerns.
Sure, and one of the last questions I'll ask the two of you as our time begins to wane. So in a few moments, once we take a couple of other audience questions, will be about the next legislative session. But before we get to that, Dennis, one of our questioners has a question that probably both of you have an opinion on, but I'll pitch to you first. This questioner writes, some people are not wanting to go back to work because they receive more money on unemployment. What's the remedy to this unintended economic consequence? Well, that's always been a problem with extended unemployment benefits. We've seen that play out over the years, and most people who have looked at that issue have done the research, and it shows that the longer you keep unemployment benefits in place, the longer people stay out. And so if you cut those benefits in half, people go back to work. So the issue here is that we've gone to 39 weeks now,
And more importantly, they've added a large excess payment on top of that unemployment benefit. I think the number was $600 a week, which most people who would never earn. And so they're not going to want to come back until they go through that process. So that's counterproductive. And that's what government does. That's not thought through. That's not well reasoned. You know, you can always add to the unemployment if the benefits, if the unemployment stays high, but why would you go out immediately and put on 39 weeks? I mean, what was magic about 39 weeks? That's, once again, we just pick numbers out of the air. And where's the science behind that? Where's the data to support 39 weeks as a perfect period? What was the reason for $600? I mean, $600 in Laredo or San Antonio or Amarillo means a lot more than $600 in New York City. So, you know, I mean, we've seen that with labor laws and how they've practiced out of Washington and New York and the Northeast and setting labor standards, which basically don't exist in the rest of the country. So, yeah, that's just a very troublesome thing. Again, are we going to be able to get people back to work right away? Theoretically, if they've been offered a job, they have to take the job or they lose their unemployment benefits. But then we've heard now that said, well, if you've got if you're fear for sickness or for your health, that you don't have to go back to work. Well, you know, they're just adding more burden to the business world in order to try to get these people back to work. So I don't think that's going to be a huge percentage, but it could be enough to create an obstacle to our growth. And we saw that it took high levels of low unemployment in order to bring lots of people into the workforce. We have some of the lowest labor participation rates in the world going into this crisis. And because of low unemployment for a period of time, those labor participation rates for the first time in decades started to rise. And so we were getting more people back into that workforce. And it's a shame that we've lost the momentum of that low unemployment to bring people back. We've heard, you know, Hispanics and African-American age working at the highest levels in history. So it's a shame we've lost that momentum.
It's a real tragedy, just considering the historic gains that have been made, especially in the last 3 years for many people in Texas and beyond. Victor, I know you've seen this dynamic of the unemployment industry.
Yeah.
Speak to that.
So remember, our hero Reagan said about business, said, you know, if it moves, you tax it. If it keeps moving, you regulate it. If it quits moving, you incentivize it. So I think what we've done right now is incentivize people not working. And I don't differ much from Dennis's point. I just say, being on the front lines, I see it more acutely. If it wasn't for these benefits, we'd be open in Amarillo right now, because we had decided to go ahead and open with a curbside and 25%, even with those constraints. We had a staff of about 55 people in Amarillo. When we tried to gather people up, we had about 8 people that wanted to come back to work. And that was just because, you know, some of them may be generally concerned about their well-being, but most of them are getting paid to stay home. And so it's like my dad always said, you know, he could distill things down to their very essence. And the reason I think the way I do, because I grew up in a small business, and we would try to get folks to come to work, but they were being incentivized to stay home by the government. He said, we're competing against the government for labor. We're asking them to come to work, and the government's telling them to stay home, and they're getting, you know, about the same amount of money. So I see it as a pretty big threat, actually. If they continue to extend these out, then small business owners like myself and others are just not going to have the staff, especially in the service industry. We're just not going to have the staff for them to come back to work, to get open. Fact of the matter is, right now, we'll have to go back and start from scratch to rebuild our staff in Amarillo. So that's a devastating thing. It's like opening the doors all over again. So we've seen the bad part of the incentives. I understand that, and I'm glad, you know, some folks definitely need them, but at the same time, it's going to have a pretty bad effect. Already is having a tough effect. And that's not just from my standpoint. You can, across the state, the colleagues that I'm talking to are having the same issues. It's just staffing up after this, you know, because of the incentives of people staying home.
No, I agree with Victor on that. I misunderstood me. I think it's absolutely disincentive to work. And I think when they've gone out and put these long periods of benefits, that people just stay out. They won't go back to work. That's why our labor participation rates have been so small, with all the food stamp programs, all the social support programs. Those programs are very, very destructive to people's, initiative to work. And so, yeah, it's a problem. We haven't faced that yet, as we haven't brought a lot of people back. But we'll see here in the next few weeks as to whether we're going to see people willingly come back to work.
Right. So as we sort of help spur along the reconstruction of the demand side of things, we'll begin to see what happens on the supply side, namely whether, like in your case, Victor, you're able to bring sufficient staff back to provide the supply. So I'm reminded too by both of your comments that obviously it's important to work for the economic benefits, and that's not only not bad, it's very good. So we shouldn't associate, we in society shouldn't associate economic growth with something that's evil. But we also know, as Arthur Brooks said in his book, The Conservative Heart, that work brings us dignity. And that's the thing that concerns me the most, that we know from so many of these government programs that they've evolved well beyond that limited safety net sort of temporary support to provide people into sort of permanent arrangements. And I think that's one of the things that we're expanding far, far too greatly right now. So that's a pretty good transition into the last question about policy I have for you before the final question. And that question about policy is, what, if anything, should Congress and the Texas legislature, which of course is not going to be meeting until next year, do in response to this crisis? Dennis, we'll start with you.
Well, I think the biggest thing that this pandemic has shown to me is the fact that we're woefully unprepared in the medical community to support these kind of problems. And if the criteria for shutting down the economy is overwhelming our health care system, meaning our hospitals, then we got a real problem. Because most of our health hospitals, like any other business, are for-profit businesses, and they're not going to run with a lot of excess capacity. Our hospital, I used Laredo and looked at it. In the city of Laredo, we have about 200 room availability. We're doubling up and doing other things to be able to support a surge in problems from a pandemic or other kind of health scare in a city of 260,000 people. So what does 200 rooms do for you? Nothing. And so we need a national plan, certainly, to deal with healthcare concerns in a pandemic. Do we have mobile facilities and other kinds of responses? What about the PPE, all those personal protective equipment? We had none. Hospitals running out of gloves and face masks almost immediately. It shows that their emergency preparedness programs were probably not adequate. So I think the biggest thing I think coming out of this that we have to really look at is a national plan on how to deal with the pandemic and the national resources. And everybody said, well, it's too expensive. Well, I don't know. We've spent $10 trillion here probably before this is all said and done. I think we can put some money into a plan that works. I mean, on our business banking, we have a disaster recovery plan. I have a very, very robust process to maintain my operations in any kind of an issue, a pandemic or natural disasters and other things. And so, yeah, those plans can be put together. And then we also have to worry about, as Victor pointed out, how much of our drugs and things are going to be made overseas versus in this hemisphere. I think NAFTA, the border, the things that have come on with USMCA now will be very important because we can bring those things back to this hemisphere and be better control of it, neighbor to neighbor control instead of across, 10,000 miles to go find a drug. So I think there are things in the medical side and the logistics side of our business and the world have to be looked at as a big issue here, because we can't be held hostage to the one predicate that caused this shutdown was overcapacity, overreaching in our hospitals. And that is with 200 beds in Laredo, if we're going to run out with 200 beds, that means we're going to shut down every 2 or 3 years. The system can't absorb another one of these. We just can't do this again.
Right. Victor?
Going back to my analogy on riding a motorcycle, guys that ride like I do say, we dress for the crash. We expect the best, but you prepare for the worst. I agree wholeheartedly with Dennis in the sense that our policymakers have been not been proactive; they've been reactive. And I think the PPP and the weaknesses and all the structural weaknesses that we have that have been exposed through this pandemic are, quite frankly, mind-boggling. The fact that we're ill prepared for most of any of these things kind of blows your mind. And so I think what we need to do is start taking more of a long-term look at the policies that we put in place, that we have initiatives, that we have things in place for situations like that. It's in my mind, I'm thinking we have policies or things in place for disasters, whether they're natural disasters or what happened if a dirty bomb hit, they took out our electrical grids. we think about these things, and in my mind, I kind of soothe myself thinking, well, surely there's a plan for that. Obviously, there's not. This shows that there's not. So I think that you're asking what can Congress do? What can we do on the state level? I think we need to be more mindful going forward. We need to think more in terms of 10, 20, 50 years out instead of just making, 2-year policies. And so I'm hopeful that now that we're awakened into this fact that we do away with the government overreach that we're having, but at the same time have certain things in place, as Dennis suggested, for that we have a preparedness and readiness for these things to happen. Surely it'll happen again. And so we need to be more prepared. It's like Dennis said, it's too costly to do it. Remember the old commercial, you pay me now or pay me later. There's an old adage and that I like. So in our restaurant business, they said, well, what if we train this staffer? It costed me about $3,500 to train a staff member. They said, what if I train them and they leave? I said, well, what if you don't train them and they stay? What does that cost us? So I think that's kind of the way we need to look at it now, is being more proactive and think about what's it costing us to not be prepared. And you're right. By the time this is all said and done, we're going to be in the trillions of dollars. So what would an ounce of prevention saved us in this case?
Well, I appreciate those, gentlemen. Last question with just a few moments left is, if you have words of encouragement for our audience members, what they can do as individuals, members of their community where they live, to accelerate the pace of recovery, to emphasize a certain message, what would you say to them? Dennis, we'll start with you.
Well, I would say be Texans. We've always been the can-do spirit people. I'd say take care of our seniors. Every family member has a responsibility to look after them. And that's one area we should really focus on. But be Texans, get out and do the work and get government off our back in this situation and allow us to get out from under all this fear. But it's in the senior classes where we got the problem, and that's where we should be focusing on and stop this craziness that's going on with shutting down the healthy people in the state.
Thank you. Victor.
So I would say, like Churchill said way back, when he was in charge of the war, he said, it's not the end. It's not even the beginning of the end. Maybe it's more like the end of the beginning. And so I would say that this pandemic has just awakened a lot of good in us. Obviously it's brought a lot of bad out, but I can say that I've seen in my own community, small communities, a tremendous amount of neighbor to neighbor service. People that have gone out of the way, sacrificing, people on the front lines, whether they're first responders or nurses or physicians, that have put themselves, in harm's way and done that in heroic measurements. And so I think that if there's a word of encouragement, the fact of the matter is that we serve a mighty God. We're made in His image, and you're right. Work dignifies us. We were called to be creative. We were called to work before the fall. So work is a good thing, and it does bring us our dignity. And right now is not a time to be afraid, not a time to cower. Right now is a time to think innovatively, creatively, and think how we can serve our fellows. At the end of the day, work is just serving. It's serving others and to love others and to facilitate their well-being and their highest good. So I think that's part of our human spirit. And I just encourage other folks to continue to do what you're doing, and to be filled with faith instead of filled with fear, and continue to serve our fellow Texans and our fellow Americans that we've always done.
Both of those are such great. In fact, they go hand in hand, because to be Texan, as you say, Dennis, is to do precisely what Victor has said in terms of serving others. I want to say as we close, thanks again to the two of you. You did a wonderful job. Appreciate most of all what you're doing in your businesses and your communities. And just to emphasize what Dennis and Victor said, I would say, just a reminder from American history, Alexis de Tocqueville said that our government is a reflection of us as a people. And so if you've been grocery shopping, which I'm sure you've been doing, putting a little bit of gas in your car, extend that. What you can do to accelerate the reopening is to go to parks, come to the sidewalks in Austin. And it doesn't mean that we've got to be ugly in that very civil defiance of local overreach in particular. What it does mean is that we're going to perpetuate what makes us Texans, what makes us Americans, which is that we're free and we give our consent to the government to govern us with our participation. And I think it's really important that we really be clamoring for all of these restrictions to be lifted, because it's summertime in Texas and we're ready to be Texans. So thanks so much for joining us as our audience. Next week, we'll have an equally entertaining visit. Tomorrow, if you're enjoying these, know that we've got a special live stream on China policy for the first time in our history. Dennis Nixon, Victor Leal, thank you. God bless you, and may God bless Texas.
Thank you.